DW Africa Link.
Uganda recorded its first Ebola case on May 15, 2026. A traveler from the Democratic Republic of Congo, the epicenter of the Bundibugyo strain of the virus. Currently, the number of confirmed Ebola cases in the DRC has increased to 837, including 196 deaths. However, Uganda has since the first outbreak recorded 19 cases with 2 deaths. So what is Uganda getting right in its fight against Ebola so far? That's what we're unpacking today. This is Africa Link, the podcast that connects you to the stories that matter across Africa. I am Ajua Tinkrama Domina, your host for today.
Africa Link, every weekday here on DW.
The Bundibugyo Ebola strain is fast-moving in the Democratic Republic of Congo. Currently, the country has nearly 900 cases with multiple deaths. The Africa Centers for Disease Control and Prevention, Africa CDC, has warned that this outbreak could become deadlier than the worst Ebola outbreak on record, which killed more than 11,000 people. However, in Uganda, the situation is different. The country has recorded fewer cases and fewer deaths, a development analysts attribute to measures instituted to contain the outbreak quickly. Today, we are looking at Uganda's approach in containing the Ebola outbreak and what lessons can be learned from it. Joining me now for that is Dr. Janelle Beman. She is a South African virologist and DW's Frank Yiga in Kampala.
Frank, I'm going to begin with you. Since we recorded the first Ebola case in Uganda, walk us through what has happened, how the disease has been controlled in a way that we are not recording so many outbreaks.
We're living by the adage of once bitten, twice shy. We've gone through outbreaks and pandemics and all that. We had Ebola outbreaks before throughout the years. And then we also had the recent COVID-19 pandemic. So we've gone through such situations, and there's no panic at all here. I can assure you that, of course, we've seen this before. But of course, on May 15th, it's when the Minister of Health reported the Ebola outbreak following an imported case from the DRC, where a patient was reported dead. When he was brought to Kampala Hospital, that's Mulago Referral Hospital. Now, a few days later, that was on 21st May, the World Health Organization reported that Uganda had officially declared the outbreak after the disease was detected in the country. And we have 2 border posts, one in Bundibugyo, that's in western Uganda, and another one in Kasese. Those are districts where the Congolese pass to come to Uganda. So when we had the news, of course, there was concern that, yes, Ebola again, it's like a wake-up call to be cautious, and also put in place some precautionary measures like they urge us to do. The ministry has intensified campaigns, putting on masks, all hospitals and other gathering places. You have to wash hands, you have to sanitize. There are also some detectors. For instance, in hospitals, you cannot enter the National Referral Hospital without being checked at the entry point. And they check for fevers, they check for your history, and then once they discover that your temperature is high, they isolate you somewhere in a small shelter, and until they do further tests and investigations. And once the fevers are too high, that's when, and you test positive, that's when they put aside. But of course, it's been a concern to many people because based on our weather here, temperature usually high in people's bodies. So many of them are put aside in that scare, thinking that maybe they could have the disease. But eventually, when they investigate, there are no cases. We had some big days, national holidays that were halted because of the pandemic. What we have one of the big religious day that brings in pilgrims from DRC, from Nigeria, from all over places to converge here for prayers. That was put on hold because of the Ebola fears. We also had the National Heroes Day that we celebrate every year, was also put on hold because of Ebola.
Interesting. I see one of the precautionary measures was the closure of the border. And there are two sides to this. On one hand, I've seen the WHO boss, commend Uganda and all the efforts that you have put in place to, prevent the spread of the Ebola disease. In fact, he says he is confident in quote that through these efforts, the epidemic can be brought under control. But he also says that the border control is affecting people, and so authorities should reopen the border. What can you tell us about this? How are economic activities around the border since the closure?
Now, about the border issue, yesterday I managed to make some investigations. I made calls here and there, and then I was told that one of the markets, not one of the markets, but they usually hold weekly markets. They call them cross-border markets. On a weekly basis, where traders from Uganda and Rwanda converge and sell merchandise. Now, these markets were closed, and of course, it's affecting people's incomes and cash flow. Trade is being affected. But of course, they told me that they are not so worried about that. It's just temporarily because they have an alternative to that, and that being that they have both sides, DRC and Uganda, have now markets without crossing borders. That's in the meantime, as they await the reopening of the borders. And yes, it has affected trade because we have a lot of farmers, especially who transport their produce to DRC. It is hard for them to go. And it's also hard for the others, the Congolese, to cross to Uganda. But those who manage to cross, it's not like the borders are closed totally. Those who manage to cross go through some serious checks. And I was told by the district health office of Ndibujo district that they have a facility there. Every driver, every work of the truck, because there are other workers on trucks, everyone is subjected to serious temperature checks and other measures before coming into the country. And of course, besides the closure of the borders, even at the airport here, some flights were affected. Some Ugandans who work abroad, especially in Asian countries, had their flights interrupted. Once they heard that you're from Uganda, well, you have to put on hold. You have to be put on hold until further investigations were done to confirm that you don't really have Ebola.
Right. Thank you for that. Dr. Gina, I'm going to bring you in now. How significant do you think the issue of the border closure is? And do you think it has, relatively contributed to the low cases we've seen in Uganda?
Every intervention you put in place will have some or other impact, The problem is that, as Frank rightly said, it's not a full border closure. When you impose border shutdowns and border restrictions, you obviously encourage undetected or informal migration between places. And so that is really the main issue, the main problem that arises when countries issue border closures. So it's really difficult, to man that full span of the length of the border. And when you have these formal border closures, yes, the people that can follow due process and have the ability to do that, they will comply. but it also encourages, unmonitored, informal routes of border crossing, which then, adds another layer of complexity in terms of being able to then trace those people at all. So, I know, like, from a WHO perspective, they formally discourage border closures during public health emergencies. And I think Ebola is slightly different in terms of the way that it's transmitted. But certainly with the SARS-CoV-2 pandemic and the COVID pandemic, those border closures had no impact really on the transmission of the virus. It still spread quite extensively. I think with Ebola, it's a little bit different. It's not transmitted through respiratory droplets as COVID is. So it does make it easier to contain. But the main issue really is when you impose these formal shutdowns is the informal travel, the informal migration then that is just impossible to monitor.
Is it an issue about the Bundibugyo strain being difficult to contain, or it's just about the approaches these countries are dealing, with the disease?
No, you're absolutely right. We're seeing very, very different situation in the DRC and in Uganda. And that immediately tells us that the difference is not related to the virus itself. And the difference is due to external factors. And the main issues in the DRC right now is the issue of conflict, which results in displacement, results in migration of people. That really is a big contributor to the virus spreading. The other issue is that in the DRC, this outbreak really established itself before it was even detected. And so that also, has a huge impact. So if you've got a handful of cases to contact trace, to contain, that is very manageable. But if you've got hundreds and hundreds of cases, most of which are unknown, that becomes very challenging to contain. And so the spread then of that virus, is exponentially greater. And so those are the main issues for why we're seeing the difference in terms of the trajectory of the outbreak in the two countries. And it really isn't to do with the fact that this is a different Ebola strain than the previous Ebola outbreaks in the last couple of years.
Thank you for that. Let me stay a bit longer on the transmission. Frank, we are getting conflicting reports about the numbers of confirmed cases.
We are left with no choice but to go by the government's statement or the Minister of Health statement that 19 cases were reported. But right now, it is hard to ascertain how many have been treated, how many have been discharged, and how many are under still attending medical attention. But of course, what is on record is that of the 19 confirmed cases, 14 were imported from the DRC, while 5 were Ugandan nationals. And then authorities reported 2 deaths, 4 recoveries, and 13 patients currently receiving treatment. We have to go with the statement from the government. Minister of Health reported that 4 Ugandan health workers and 1 ambulance driver, of course, are showing signs of recovery. And the president also had a televised address to the nation, comforting us and also telling us not to panic, that the government is under control, that measures are being put in place, and the disease is not spreading. When you go by the government statement and then you also do a journalistic investigation, you get something different, and then they become conflicting.
It's interesting you mentioned conflicting, because I've seen in cases where countries deal with diseases outbreaks and you hear conspiracies about massaging the numbers. In fact, in Ghana, when the COVID-19, was in full bloom, there was a point where people thought that the numbers of cases on the ground were different from the numbers that were being reported by the government. Are you hearing these conspiracies in Uganda as well? And has the government responded in any way, if there are?
Not really, but of course, what we heard is that the government must have pressed a wrong button to report the uncoordinated outbreak of Ebola. They would have done it better than they did, because when they spoke to the media, especially the international media, the president said that a CNN, he quoted, CNN blew this out of proportion. The information was still scattered, and I think they must have realized the repercussions it's going to have to the economy, because already the tourism sector was being affected. Trade was being affected, international trade between Uganda and other countries.
Thank you for that. Dr. Beman, when it comes to development of vaccines, where are we at the moment?
At the moment, there are 3 candidate vaccines that are being, as fast-tracked for development. And 3 of them, the reason there's 3 is each of them use a different platform, and also each of them are in a different stage of development. So the first vaccine, it uses the same platform for the vaccine that was used in the 2014 Zaire Ebola outbreak. And so, in terms of safety, you've got already a very good handle of how that vaccine performs in people, and also, how effective it was. And so obviously the main difference between the Zaire Ebola outbreak and this one is the strain. It's the Bundibugyo strain. And so that's really the main difference. And so what's being done with that particular vaccine is to try and make a master stock, a massive master stock that can be ready for rapid deployment. The other vaccine is it's an mRNA-based vaccine, so similar to what was used, for example, for COVID, for SARS-CoV-2. This vaccine, unfortunately, it wasn't used for Ebola previously, so it still has to go through the safety testing. So it's a little bit further back than the previous one I spoke about. And so it's got a few extra steps to get through. And then the third vaccine, it's also based on a platform that was used for COVID. So it's the ChAdOx platform, the AstraZeneca vaccine, if you remember, that was used.
Yes.
And this one, again, we have a good idea of its performance, but it also needs to go through the safety phases of trials, because it hasn't been used for Ebola previously. It's still going to take probably 7 to 9 months before it can actually be administered to people, assuming that everything goes well with the testing phases. It's encouraging. At least we have candidates to start working with, but there's still a bit of a long road ahead in terms of when it can actually get into people and be used.
So realistically, we're looking around February 2027.
With COVID as well, that was unprecedented, the speed, but it still took, almost a full year before we could get vaccines deployed.
Can this virus be contained without, or be cured without a vaccine?
So the vaccine is for prevention, right? So when we're deploying in this instance, these 3 vaccines are meant to be administered to people before they have been infected. And it's to prevent infection and to contain the outbreak in that way. That's how these 3 vaccines will be used. It is possible, but it's rare. Unfortunately, the extent and the percentage, I guess, of people who develop severe disease with this illness and the people who then go on to die, it's relatively high, shall we say. Unfortunately, it's not a thing of, let's just take a chance, and see if people will recover. I think there's a lot of effort as well going into treatment, and the treatment in this case, because we don't have something that is specific for Ebola Bundibugyo, the idea is to make use of other antivirals that have been developed for other viruses that have kind of broad spectrum activity. There are 2 antiviral drugs that are being investigated to see if they can be brought into Uganda and into the DRC, to be used for treatment purposes. But you're right, people can recover. The issue is that it's not the chances of recovery are lower than we would like.
Is that to suggest that we are not going to see more recoveries in the coming days at the rate we have seen?
I think a big contributor to people recovering is if they are able to get supportive care. So if you're able to get the treatment, not necessarily the antivirals, but at least to get supportive care, the chances of recovery are probably stronger. So it's not to say that people won't recover in coming days, but it's to say that if the care is not there, if the healthcare system is overwhelmed, the chances of that recovery really is much more difficult. And many people, as we know, are not even making it to the hospital. Many people are getting sick where they are living in their communities, and they are not receiving any care at all, and they are dying at home. And so that is really the issue. And so I think if you think about it from a broad perspective, the goal should be is to firstly contain the outbreak, to try and identify the cases, to try and do the contact tracing, to put people in isolation where it's needed, to get people the care that they need, to contain it, and then also to prevent further infections by containing it. I think that is going to be a much more effective way of combating the outbreak rather than hoping that recoveries will spontaneously occur.
Thank you for the point. As we wrap up, I want to find out from you, what does the trajectory of infections or spread of cases look like? And what can governments like the DRC and Uganda do to further contain the spread of this Bundibugyo strain?
This outbreak is really exploding. Realistically, I think there's probably like 5 key actions that regional governments can do. And a lot of this has been developed in a coordinated continental response plan that was launched by the WHO and the Africa CDC. But it's things like, number one, contact tracing, surveillance, identifying cases. That's the first thing, is to identify those cases, find out who their contacts are, put them into isolation so that you can now limit spread of the virus. Getting things like PPE to the healthcare workers to ensure that, they have their systems in place for treating people in a manner that keeps them safe from infection, but also keeps the patients that are within the facility from infecting each other. Then there's things like the laboratories, capacitating the laboratories to be able to diagnose people, to be able to actually say, these are the cases we have. That is really, really key. A big issue in terms of the funding that we as a continent used to have and no longer have is community engagement. And I personally have seen some of the footage of examples of cases in DRC where people just don't have trust. That is the bottom line. People don't have trust in the healthcare workers or in the volunteers that are trying to assist, to ensure that people are getting buried, but that they are getting buried in a safe manner, that, further infections don't occur. And so that's a huge one that hopefully, can be addressed sooner rather than later. But engaging with the communities, helping to build that trust again, in government and in the people that are trying to help contain the outbreak.
Very well. Thank you so much, lady and gentleman. You just heard Dr. Janelle Beman. She is a virologist speaking to us all the way from South Africa. We also had DW's Frank Higa joining us from Uganda. Lady and gentlemen, thank you for your time.
Thank you to you, Joe.
Thank you.
Get the stories that are shaping the continent here on Africa Link.
As the Ebola outbreak continues to unfold, health experts like Dr. Beman are urging countries to emulate Uganda's vigilance, coordination, and community-centered action. Uganda's experience offers lessons not just for the region, but for global health systems everywhere in tackling outbreaks. A fast-moving outbreak doesn't have to become a devastating one. And Uganda's response so far is a reminder that preparedness, trust, and early intervention can save lives. Share your thoughts with us on Facebook and on TikTok at DW Africa. Listen to us on Spotify or wherever you get your podcast. And don't forget to subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Kai Nepe. I am Ajua Tinkrama Domina. Bye for now.
DW. Made for minds.